Dr. Mallika, our first question is from Mary, who writes, I am 74 and had the J&J vaccine. I feel fine, but I'm concerned about this problem with the vaccine. Should I be worried?
No, Mary, you really shouldn't be worried. I mean, this unusual blood clotting disorder that's been associated with the J&J vaccine is exceptionally rare. And when it does occur, it tends to occur in people under the age of 50. So you shouldn't worry. However, if you get a severe headache or pain or swelling in your leg, shortness of breath or chest pain, obviously you should seek medical attention or call your doctor. But I wouldn't anticipate that that's going to happen with you.
Yeah. Cynthia in Alston is planning to go to the UK in September, and she's worried that the effects of the Pfizer vaccine will wear off before she travels, and she wonders if she should get a third dose now as a precaution.
You know, I love your enthusiasm, but no, you don't need to get a third dose right now. And that's because the boosters that are in development will hopefully be better tailored to some of the newer variants that are emerging. We know that immunity from the Pfizer and the Moderna vaccines does tend to last at least 6 months, and it should last even longer than that. Time will tell if and when we do need a booster dose.
It is good too. It's the one time to kind of wait and see, right? Rebecca writes, I am scheduled to have my second vaccine shot on May 3rd. I plan to travel that weekend, so I need to have a COVID test on May 6th. What are the chances of having a false positive, given the fact that I would have had the vaccine 3 days earlier?
That's a good question. So getting vaccinated is not going to turn a traditional or standard COVID test falsely positive. That's because these tests actually look for the presence of the virus and not for antibodies, which would need to be checked with a blood test. So you shouldn't worry about that.
All right. Erin says, I've heard that if someone tests positive for COVID-19 but has been fully vaccinated, they do not have to quarantine or isolate. Can you explain why it's considered safe to be around others in this scenario?
Actually, if you are fully vaccinated but test positive for COVID, you really do need to isolate for the full 10 days. You're right, we don't know whether asymptomatic people who have been fully vaccinated could carry the virus and unknowingly pass it on to others. But if you have tested positive for COVID-19, you still need to isolate.
And here's a question I bet a lot of grandparents have. Charlie writes, I'm a 73-year-old grandfather. I've been fully vaccinated for a month. I just learned my 18-year-old granddaughter tested positive today. How soon will I be able to see her?
So you're actually very well protected now that you're fully vaccinated. Congratulations, that's great. But you still should wait the full 10 days that your granddaughter should be in isolation before you see her. So she needs to stay away from you for 10 days, and she needs to be feeling better before you have close contact with her.
Good to know. Dr. Mallika, thank you so much. Dr. Mallika offers her best advice, but as always, consult your personal doctor before making any decisions about your health. If you have a question, you can ask Dr. Mallika. Here are the 3 ways to reach out to her. Her email, drmallika@cbs.com, on Twitter @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.